Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the FIA Group.
Hello, everybody, and welcome to part 2 of Empowering Plans with the FIA Group. Corey, you're back for more. Amazing. Folks, it was so much fun after episode 1. I'm like, we got to keep this going. It's been years since I've done a podcast, and I'm thinking now I might just make this mine. I'm just going to take it over again. I'll just have my own special guest because, let's be honest, folks, who would you rather listen to, me or anybody else? Let's just be straight. So, based on that, there's been some really interesting news recently. I'm well aware. And Corey, I'd love for you to share what some of that big news is, if you wouldn't mind.
So earlier this week, Walmart Health has announced that it is exiting the primary care space that it doubled down on just at its board meeting of last year. Last year, 2023, they made a pledge to have 9,000 standalone clinics attached to Walmart superstores nationwide by 2029. And then just this past week, they're completely exiting the space in general. And when you look at this, you can say, well, Walmart getting into the health business, this is not a core service of theirs. It makes sense that it's not profitable. But Walmart was really trying to, of course, make money. But they were putting healthcare access in a lot of what we call healthcare deserts, right? Walmart's clientele and services are often rural areas where they're underserved communities, where Walmart is kind of the hub of grocery and everyday items. So they were trying to provide something that would be beneficial. And I think the larger thing that we should really talk about around it is the fact that the primary care physician market in of itself is struggling. There was a Harvard business professor when this news broke about Walmart Health closing that said that this is really just a microcosm of the PCP space in general, because largely the PCP space is unprofitable unless it's attached to your large healthcare system. They're forecasting a shortage over the next 5 years of 55,000 primary care physicians. This should be something that any of us in the healthcare space are wary of. It should be something that we're concerned about. Primary care physicians and early preventative treatment, to do a plug here, we're talking about at a webinar in a couple weeks, the cost of cancer. And one of the best ways of getting ahead of cancer is having your regular preventative PCP appointments every 6 months to a year, having those labs checked. And not everyone has access to a quick and accessible primary care physician. And based on the market forces in the PCP community, I don't know if that's going to get any better. That's what Walgreens was trying to do with Oak Street Health. They're also not seeing what they wanted to see from their clinics. Same with CVS. Same with Amazon Health, same with Walmart Health. So the question is there's a need that's emerging in the industry for providing affordable access to primary care physicians in underserved areas. How is that need going to be met? Who is going to meet that need? And what's going to happen if the market doesn't respond to it? Is there going to be a shortage?
Corey, it's funny when you said, rural America, Walmart, supercenters. So folks, I'm going to share a little story. So my sister, who currently lives in Amsterdam, lived in Barcelona, Spain for 15 years. And her ex-boyfriend, yes, it's very sad, the greatest guy I ever met. Like, I still text with him. Don't tell her that, but I still do, right? Just a great guy. His name was Dario. And Dario is your typical Spaniard, right? He follows Barca football, which is soccer here. And, he's all Spain. I mean, literally every stereotype you could think of, the accent, the mannerisms, the way he eats, what he eats, tuna in oil with salad, just the whole thing. So Dario would come every 6 months, or every year at least, and visit us in Boston. And I was doing a trip to the Midwest, and I said to Dario, how would you like to see America? Not Boston, not New York, really what America is. He's like, I'd love to. Let's go. Let's do it. I'm like, okay. So I take Dario. I'm not going to say where. I don't want to offend anybody. But I took him somewhere extremely rural to go on a client visit. And there was a super Walmart. Now remember, folks, Dario lives in a world where no one has cars. If a luxury, you have a moped or a dirt bike that they literally used in downtown, like a dirt bike. You'll see dirt bikes all around the place. And he rides a motorcycle. But when he wants to buy cheese, he goes to the cheese store. When he buys milk, he goes to the milk store. When he buys bread, he goes to the bread store. Literally 3 separate stores for 3 different items. And he sees a super Walmart from like 5 miles away. And he says, "Super Walmart." I'm like, "You want to go in?" He's like, "Please, let's go." I'm like, "All right." Well, I go, "Listen, Dario, you're going to be a little overwhelmed when we walk in because this isn't even a Walmart like we have in Boston. You know, a Boston Walmart is like a 7-Eleven. It's a very small version of what a real super Walmart is." So I'm thinking this guy is going to tell me, "This is horrible. You know, how can you have this? Spain is so much better. You know, you get fresh food, fresh bread every day. Literally, the milk just came out of the cow 3 hours ago." And we walk in, and he goes, "You could buy a gun. You could buy bullets. You could change your tires. They have a hairdresser. You could get a haircut. You could get milk. You could get eggs. You could buy steak, and you could get cereal. This is amazing. I love America. I love Super Walmart." And I'm saying to myself what Corey just said. How can it not work? How is it possible that having a doctor's office at the same place where they're selling tires, folks, they're selling you tires. You're buying milk and you're getting tires at the same time. How can you not also want to just get a quick physical or get your flu shot? Why doesn't it work? In my opinion, it does work. The problem is out-of-pocket, deductibles, people's health plans, and the way our healthcare system is designed. It's the opposite of every other economical decision we make. You walk into Walmart and you see milk, $4, $3.85. This one's $3.49. And then you make your decision, your buying decision, based on the quality, cost, and maybe the expiration date, right? That's what you're doing. Same thing with the tires. Same thing with your haircuts. Same thing with every single piece of anything that you buy at a Walmart. Those things you're looking at, cost and quality, every time. But then you go to the clinic. And what does it cost? How much is it? Do you have an office visit expense? Are you paying it out of pocket because you have a $12,000 deductible? It's a total different vibe. It's a total different feel. It's not the same quote-unquote shopping experience as every other item within that Walmart. And people say, "Well, Adam, how about your eyeglasses?" Most people don't have great or any vision coverage. They're paying it out of pocket. They're paying for, LASIK out of pocket, hence the price has gone down, not up. But that's the difference. I think until we fundamentally change the way people's minds work and get health care, I'm not talking about an emergency room visit where you have to go to the closest hospital because you're going to die. I'm talking about your planned surgeries, your elective surgeries, your random office visits just to make sure you're okay. All the preventative care stuff that in today's world, when the economy's not doing great, inflation is high, people have less money in their pockets, if you could take that $30 and use it towards groceries versus, do I really need to get a checkup right now? I'll just wait 6 months. It's causing us as an industry, as a society, to have more healthcare problems down the road because we're not finding it faster. Look at during COVID. People weren't going to the hospital. They couldn't go to the hospital. They weren't getting their cancer screenings. They weren't having their colonoscopies at age 50. Like, I'm going to have to pull it off. I have to do that pretty soon, actually. I just turned 50. I haven't done it yet, but it's a good reminder. The problem is the way we look at healthcare and how we spend money as it relates to healthcare is not the same it is for everything else. I just want your thoughts and commentary on that, Corey.
Yeah, I mean, it's a system that defies most traditional economic principles that this country was founded on and what drove this country to be the foremost economic force that the world's ever seen, right? You don't buy goods in a vacuum. You provide goods and services at a reasonable price And if you provide them at an unreasonable price, you do not find your consumer, or it breeds competition. And then competition drives the price down to gain access to same or similar products in whatever market you are in. Healthcare, the sticker price is hidden.
I mean, think about this. Every time I hear about healthcare cost transparency, it makes me want to flinch because people don't understand. Yes, it's a great first step, but do you realize, think about this. If there are 3 car washes in a town, and then right now you have a copay to go to the car wash of $10, right? Your health plan has a $10 copay. And what if all of a sudden every car wash is mandated to say what their price is? You're only paying 10. You're not paying the full boat, but you have no access to quality metrics whatsoever. You don't have reviews. You don't see the star ratings. What in the world are you going to do when you have these 3 options? Pat's car wash, $30. Corey's car wash, $40. Adam Russo, CEO, platinum, ultra platinum, concierge car wash, $3,000. Which car wash are you going to?
If I only have a $10 copay, I'm going to the $3,000 car wash, Adam, because I want my car taken care of.
You're assuming that $3,000 car wash has to have higher quality than Pat's car wash and Corey's car wash. Folks, I know you think I'm oversimplifying, but literally it's that simple. People assume price with quality. Sharing price information without quality metrics tied to it is only going to lead to higher prices. So when it goes back to the Walmart model, if they were able to show, look at the price we charge, look at what it's going to do in the long run for you, look at the quality of the physicians and the nurses that we have here, look at the quick access, the quicker turnaround, faster dispensing of drugs, etc. All those pieces that makes people look at healthcare not just as a patient of care, but as a consumer of care is truly the difference. Corey?
Yeah, I mean, we're in a situation where the consumer in this is not the primary payer, and consumers just worry about what is coming out of their pocket, and they don't think about their health insurance, right? It's deducted from their paycheck every 2 weeks. They have it. They know that so long as they stay in a network or follow the pre-cert guidelines that they're going to pay X, and then it doesn't matter where they go. But Adam, I mean, we're in a scenario where, great, let's publish the prices, but the prices aren't tied to the value of the product that you're given. I can charge $8,000 for an MRI at provider A. Provider B can charge $4,000 for an MRI, and the MRI for $4,000 could be the same or better value based on who is reading it, based on it, whether or not it's outsourced, based on all kinds of different factors. But it doesn't matter to me because I just need an MRI and it's $50 out of my pocket regardless.
And it's upstairs. It's upstairs, right? It's on floor 4. You're on floor 3. That's why.
Yeah. So why am I going to get in my car to drive to this standalone imaging service that's going to cost me more time and gas when I can just walk up the stairs and pay triple of what it's worth or double what it would be worth if I just put a little bit of effort into doing some due diligence? And that's what's great about the VIA mission is we are a holistic company that wants to improve the industry as a whole. And it takes education and buy-in at all levels. That's why taking time out of your busy day, Adam, is so great to educate our clients on what is going on. That's why the webinars are such a great tool to get this into the forefront of our clients. And then hopefully there's a trickle-down effect where we're saying something that resonates that you can take back to your clientele, and Joe Schmo who owns a small business can pass that information forward and have a better informed consumer of healthcare population. That's what this is all about, right? I love listening to myself talk. I'm going to take a bet and say that Adam likes to listen to himself talk, but it's really about the education and the content.
Speaking of betting, this all started because of a bet on the Derby, right? So let's end it with that. So folks, if you're a betting man or a woman out there, what did we just tell you? That all these, whether it's Walmart, whether it's Walgreens, whoever it is, bet against them in the stock market. Why? Because until they actually have a plan of attack, a strategy to get patients to change their behavior as it relates to how they're accessing that care and why and what it means, nothing's going to change and these are going to continue to fail. So that's the bet that we're going to be giving you today. It's probably something you want to do. Bet against these folks working unless they come up with a new innovative plan that takes cost, quality, and patient behavior as part of the mix. That's all the time we have, folks. On behalf of Pat Santos, our great producer, and Corey, I want to keep doing these with you, man. This is fun. Maybe we have to branch off and create our own podcast. You know, Louisville and Boston. We can figure some kind of connection out, right? I think that might be a good idea. What are your thoughts on that? Would you want to continue this?
Adam, I would love to continue it, but you know what I love more? I love your Cavs to cover on the road tonight with the Donovan Mitchell over. How about that?
Oh, man. I don't want to get into the case. See, that's where it gets personal for me. It's not business any longer. Now it's personal. You know, just so you know, folks know, you bet $100 on the Cavs before the series started, you win $800, okay? This is David versus Goliath. The only chance the Cavs have is if literally a tornado rips through the Garden and takes out Tatum and basically the entire starting five of the Celtics. If that happens, we got a chance to win. Otherwise, I'm just happy we won a series. Folks, thank you so much on behalf of Pat and Corey and myself. Thank you for empowering your plans with the FIA Group. We love you. Have a great day.